So we're now going to hear from the practitioner perspective on this issue, which is a really important one. And to help us understand what tools and approaches practitioners are using on the ground to answer these questions, we're going to turn to Sandeep Bashel. Sandeep has been working with OCHA as an information management officer since 2005 and has been in Afghanistan for 3 years. Sandeep also has experience working in disasters and complex emergencies in Nepal, Myanmar, Darfur, and Pakistan. Many of our listeners will be familiar with the 3W forms that OCHA uses at country level to map presence, and Abby has just referred to these as well. But the question is, what is OCHA doing to complement these forms to get a fuller picture of presence and coverage? We're going to be hearing from Sandeep on this, but just a quick minute. Sandeep, I think we're seeing only part of your PowerPoint slides, so I think we will run your PowerPoint slides from our end, and you can just start your presentation and tell us when to turn the slides over. And I should just also remark to everybody in the room that if you have questions of clarification, I neglected to mention this after Abby was done speaking, but if you have any questions of clarification or follow-up discussion questions that you'd like us to cover after Sandeep's presentation on either Abby's or Sandeep's presentation, please start entering those into the chat box under the questions tab. Great. So Sandeep, over to you to talk, and then we'll be turning the slides over on our end.
Thank you for this opportunity to talk on this webinar. I am just going to do a quick run through of the traditional 3W tool that we use in Afghanistan, like in any other countries. Just a brief methodology of how we use it and what we're using it for, its scope and limitations. And then I'll be also going briefly about some supplementary tools that lets us do more in-depth analysis on humanitarian presence. Okay, the OCHA 3W in Afghanistan is basically just a list of organizations by their sector and district. So nothing, we don't collect any more data than that. This is mainly because these NGOs and other partners have a lot of reporting to do, and we don't want to put in additional burden on them. So we just asked them 2 questions. We just asked them whether they have an active humanitarian programming or have carried out an humanitarian assessment in the last 3 months. And by humanitarian programming, we mean projects that are in line with the Humanitarian Response Plan Monitoring Framework or projects under the Common Humanitarian Fund. So these go into the operation. These lists of organizations go into the operational presence, and then we have a separate list for agencies that are not strictly humanitarian. They are not currently conducting humanitarian activities, but they have access to the districts and the capacity if there's a need and funding is available to actually conduct humanitarian programming. The data is collected by OCHA sub-offices. There's no direct reporting from the agency to OCHA, so it's just actively collected. This just gives us a baseline overview of what agencies are present in the district. So this is just a simple methodology of how we collect the data. So our sub-offices collect these names of agents and just acronyms of agencies directly through phone calls or through coordination meetings. It's not collected in a very structured way, so it's just a comma-separated list. And back here in Kabul, we take all that data apart, compare it to a standard list of organizations. We assign them the actual names of the organization and type of the organizations so that we have a structured data. And some of these agencies do not want to be named publicly. So we filter out that information before we create our products. So our products are just the regular products, thematic maps, data that you can find on the Humanitarian Response Humanitarian Data Exchange website, and interactive dashboards that you see at the bottom below. Along with the names of agencies, we also maintain a contact list of at least one contact per organization. So these are also collected by the sub-offices, and we consolidate them here. And some of the key contacts are, we manually add them to the Humanitarian ID, which is kind of a which is a global contact list of humanitarian workers. But for Afghanistan, it's not quite public. You have to be a verified responder to be able to access that list. Our interactive dashboards do offer some level of analysis. You can just look at the coverage by sector, by type of agencies, or even click on a district or province or a region to see who is reportedly working there. And you can also see trends over time. If you look at the green dashboard, it has data since 2013. So you can just scroll over the data and see how the coverage has, how the presence has changed over time. So the 3W is more of a baseline list of humanitarian presence, partner presence. We call it presence and not coverage because it had some limitations. This is the most comprehensive list of organizations that are working in the districts and includes local agencies or other partners of partners who may not be directly reporting to the cluster system. So the main use would be to actually click on a district, see who's working there, and find somebody to contact to get more information on the district. And of course, we can see changes over time on the number of personal partners. It just provides a baseline data, and it has some limitations. So it does not really show the extent of coverage in a district. Like a district may show 15 organizations working there, but there could be just one person from the agency visiting once a month to the district headquarters. So it's not an indicator of either the scale of the response, capacity of the agencies to provide support, or even gaps in response even if we compare with the needs. Also this 3-month cycle does not give an accurate picture of presence in a constantly changing humanitarian situation. So there are these supplementary tools that we have to get a more accurate picture. There is a cluster reporting system against the humanitarian response plan. So all the clusters have their own activity-based 3Ws. Although the level of detail and the frequency of reporting, it varies from cluster to cluster, but all of them have the number of beneficiary supported by type of activities. We have a periodic monitoring report for the HRP, and we use this information to measure the progress against the needs, targets, and identify potential gaps in response. The other tool is OCHA collects. We have these two different tools, the natural disaster tracking system and the displacement tracking system. So our field offices collect top-line information based on assessments in the fields and reports from partners on internal displacements and areas natural disaster events. This includes number of affected population, number of people displaced, and also the organization provided in assessment and response. So it's activity-based, and the data is live, so it's updated every day. We can use this to actually identify changes in the humanitarian context, like which areas have been difficult to reach, and who's working in these areas. I just talk about how the 3W does not have any information on capacity of organizations. So the Common Humanitarian Fund, to be eligible to apply to the fund, NGOs have to go through a 2-step process. First step, where they submit an initial checklist of their activities and capacities. So that qualifies them to be a potential partner. Those who qualify in the first steps, it's called the due diligence review. There is a more detailed assessment of the partners. It's done by an external consultant. Those that qualify also receive a risk rating. So this helps identify potential partners that would be working in hard to access areas or that have the capacity to respond to emergencies. In Afghanistan, due to these hard to access areas and high conflict incidences, CAS-based programming have been getting more popular. There was also a partner assessment conducted recently of this CAS-based transfer programming. So there is a mapping of the list of partners who have implemented these in the past, and they are, who are implementing these currently. So it's also a capacity mapping of these partners. It gives them a ranking of each partner has received a score of their ability to deliver these CAS-based assessments. So these are some of the tools. In 2017, one of our priorities is for the humanitarian response plan is improving humanitarian conditions in areas of conditions for people in hard to access areas. There is an access advisory group under the humanitarian country team who is looking at a more systematic approach to measure access indicators and as well as humanitarian coverage in these districts. So that's about it from my side.
Great. Thank you so much, Sandeep, for a really great whirlwind overview of all that OCHA Afghanistan is doing to get a grasp on the presence question. We've had a couple of questions come in over the chat room, Sandeep, so I thought I would put two of those to you if you don't mind. I know you've just been talking quite a bit. But the first question is a pretty straightforward one about the DTS and NDTS, if that's publicly accessible. So is the DTS and NDTS publicly accessible? And the second question, and that question was from Katerina Hamed. The second question is from Michael Tarsila, who is an evaluation consultant working for UNICEF in West Africa. And Michael has asked, in response to your first slide, I have a question on capacity measurement. What tools do you use to measure the operational capacity of humanitarian actors, such as international NGOs, that might be interested in contributing to the humanitarian response, but do not yet have any presence or staff in the country or in the affected areas? So that's a question. You mentioned, Sandeep, a few times about operational capacity, that the 3Ws don't assess this, that you have the CHF partner capacity assessments, and then the specific cash capacity assessments. Beyond those that you've already discussed, are there other capacity measurement tools that you can use to measure the operational capacity of new humanitarian actors, new international NGOs that are not currently part of the response but want to become part of that response? And then the first question on DTS and NDTS and it's being publicly accessible. So if you could answer those two questions, Sandeep, we'd be most grateful.
Yes, the DTS and NDTS are both publicly accessible. The data is on in the Humanitarian Data Exchange platform, and there are interactive dashboards both in the Humanitarian Exchange platform and the Humanitarian Response website for Afghanistan. For your second question, like when I talked about operational capacity, it's not really a capacity assessment. So it does not really, like, although the name suggests capacity, but it's not really a capacity. It's just a potential. It's just a potential capacity of organizations that may be able to provide humanitarian assistance, but who are not currently doing so. Other than the CHF and the recent CAS-based programming, we currently have any other capacity assessment programs. Even though, like for new NGOs, even though they are not working in Afghanistan, they could certainly always be a partner of other agencies that are working. There's no restriction that the agency has to be previously working in Afghanistan to apply for these capacity assessment for the CHF. Does that answer your question? Like they can have a track record in other countries?
I think that that gets to the question, Sandeep, and I think if Mikhail has any follow-up, they can feel free to contact us and we can follow up after the webinar. But I think that that's a really good overview response to that question.